Hello everybody, this is Dr. Santosh Patil and I'm a medicine educator for Prepladder NEET Assist. The reason we're connecting today is not something academic. I have done plenty of academic videos discussing various academic topics, but today we are connecting to discuss something very important. We all are aware that the 4th of September we are celebrating the World Sexual Health Day and it's a very important day. Now this year's theme is Let's Talk Pleasure, but I am going to talk a little more beyond that. As a practicing physician, I do see a lot of patients who passingly comment about their sexual health issues during our regular interviews. And I, as a physician, need to take that very seriously. It's not only about the performance in bed. It might mean something more sinister happening underneath, right? It could mean that there is an underlying major disease which can affect the patient's physical performances, or he has maybe sometimes issues concerned with psychiatry. So I might have to refer the patient to psychiatrist, or as a physician I might have to evaluate for underlying causes. I can quote an example, like someone who presents with erectile dysfunction. Now today we do understand that erectile dysfunction can be a marker of the atherosclerosis of blood vessels. And we all know that atherosclerosis of blood vessel is definitely a risk factor for coronary vascular disease or myocardial infarction or ischemic heart disease. So it is related to mortality. So if someone in their mid-30s or 40s present with erectile dysfunction, as part of his evaluation, it's very important that we cover for the risk factors for atherosclerosis also. It's not merely about prescribing him some Viagra kind of drugs. So when we evaluate, if you find out that okay, he's having dyslipidemia, hypertension, diabetes mellitus, we can address those risk factors, and by addressing those risk factors, we are minimizing not only the physical impact of that underlying disease but also the mortality. You're probably saving his life. So do not ignore the sexual health, and if you're a practicing doctor, please make it a point that you educate your people, your patients about sexual health and encourage them to report abnormalities or troubles with their sexual performances to the hospital or the healthcare provider. Most cases they would require a physician to be involved, they might require a sexologist to be involved, and they might require a psychiatrist to be involved to help them come out of both the issues related to sexual performances and their underlying diseases. And basically speaking, the taboo around the sex should be decimated, because this taboo makes patients hesitate reaching out to the healthcare. And sexual pleasure is one of the essential part of human life. So it is anticipated that people come out in open and report their troubles to the healthcare provider, and it is only possible when we healthcare providers take the onus on us and educate the general population that it is no longer a taboo. You can come out and talk to us, and the secrecy will be maintained by the healthcare providers. So with that message, I'm signing off, guys. I'll be seeing you soon with academic videos.